Hello, how's it going? Rania here. So, I had LASIK eye surgery exactly 1 week ago, and I can see it's been great. Uh, I had a lot of people messaging me this past week and asking me how it went, what my experience was. So, I thought I'd make a video about it and share that. And I want to start by saying that this has just been my experience with LASIK. Um, of course, there are other people that had much worse experiences, and yes, there are a lot of dangers. So don't take that as an official consultation, okay? I just hope that this can give you some of the details of the procedure so you're better informed about what you're up against in case you decide that you want to go through with it. So, I have had short sightedness, myopia, for as long as I remember. I used to wear glasses more than like 10 years ago. I didn't particularly like them, so I switched to contact lenses for the past 10 plus years. I used to wear monthly contact lenses, and then I switched to daily contact lenses because I just hated the process of having to clean the monthly contact lenses. And my degrees were -2.5 in the left eye and -3 in the right eye. So not horrible, but enough to be very annoying for everyday activities. So I've been thinking of having this like laser procedure for a very long time now, but as probably many of you, I have been putting it off and off because it's scary, right? Yes, it is. Finally, at the beginning of the year, I just said, yeah, okay, let's at least have the consultation, speak with the doctor, and see what they tell me. So that's what I did. I did the consultation, I booked the appointment, and apparently, one thing you should know is that if you're wearing contact lenses, especially long term, you need to be off the contact lenses and back to glasses for me it was at least a week, but depending on the type of contact lens, it could be longer. And this is annoying. I don't know if you realize, but if you haven't got used to glasses and you just switch back to glasses, I don't know, for me it was driving me crazy. I had to have something like, in my face all the time. I couldn't touch my face. I couldn't lie down on the couch because the pillows were pressing my glasses. I couldn't go outside easily because the slightest drizzle just, made marks on the glasses. You went outside and you came back inside and everything was foggy. Anyway, I endured that for a week. And then it was the consultation appointment. So in the consultation appointment, they have to measure a few things in your eyes, particularly the most important factor that, in my understanding, is the thickness of your cornea. Cornea is the outer layer of your eye, the transparent outer layer of your eye. And at least in my case, my doctors considered a safe thickness more than 0.5 millimeter. And luckily, I was in that category. I had a thick cornea. The reason for that is that basically with LASIK, they open a flap, a very thin flap of this part of your eye, and they sculpt the inside to create the correct curvature for your lens, and then they close the flap. But in order for them to do that safely and for your eyes to not be dry and to heal properly after that, you need to have, they need to have material for them to work with. If you don't have a thick cornea, there are other procedures that you can have, so you should ask your doctor. I think that you should go with the recommendation. If you're not a good candidate for LASIK, don't go through with it. There are other methods. Just research. And in the end, even if you can't have anything, contact lenses are not a horrible thing. If you are wearing glasses though, I would definitely recommend trying contact lenses and giving them a chance. I know it's weird, and a lot of people with glasses say it's weird, that you have to like stick your finger into your eye and then stick a thing there. Just give them a chance for like a couple of weeks, because after that, I promise you get used to them, and it's so much better to have your full, peripheral vision and everything available. So, they also, in the pre-op exam, in the initial consultation, check other things like the curvature of your eye. No, not the curvature, sorry. I think they check like the general health of your eye, if you have any other eye problems, if you have family history potential of other eye problems. So in general, basically they determine if you're a good candidate or not. And if you're a good candidate, they basically start you on some medication and book your actual procedure. The medication they usually put you on, at least in my case, is mostly antibiotics, just to make sure that there is no possibility of a pre-existing infection in your eye when you have the LASIK surgery. So you continue wearing, of course, glasses. That doesn't go away. You're not back to your contact lenses, but it's fine, it's good. You can take it, you can tolerate it, it's worth it. So the day of the procedure comes and you have to go there fairly early, because they make the appropriate, again, eye exams just to make sure that everything is still good to go. And they start you on drops. They start you on a number of drops that basically numb your eye, keep your eye hydrated. And it's actually very weird, because when your eye is numbed, you can see the drops falling, but you can't feel them anymore. They also give you a mild sedative, just to make you feel a bit more relaxed for the procedure. So I don't know, for me at least it was an okay experience. It wasn't anything horrible. It was relaxing, and it wasn't painful, or it wasn't bad. Anyway, it was not comfortable, but it wasn't bad. So the time comes, they get you in for the procedure. You lie down in a chair that can basically rotate, so they can switch you from machine to machine. And then you go under one of the machines that creates the flap. Again, it's not painful at all. You just feel a bit of pressure. You feel as if someone is basically putting something, pushing it against your eye, like a finger, something against your eye, but it's not painful. And because you're numb, and because they keep your eye open with a device, you don't really blink or anything. It's very fast. They just keep your eye open, they put some kind of suction, and then they create the flap in less than 10 seconds. 10 seconds, that's it. Then they switch you to the other machine, and they make the actual curve. They sculpt the eye, and this is another, I think, 12 seconds, during which they count down, so you know what's going on. And then they repeat the process for the other eye. So the whole process in there is less than 4 minutes. Okay, it's fast, painless, not comfortable, but tolerable. You don't have to worry about moving your eyes, because the laser is automated, and it tracks the small movements of your eye, and it follows them. And if you make a very big movement, it just stops. They tell you to focus again, and they start. So there's no issue there. What's also happening is that what you're seeing through this thing is basically lights at which you have to focus, and then it's just things go in and out of focus. That's it. You don't really see much. You just see basically light. After that, they take you back outside. They start for about half an hour putting drops in your eyes all the time, and they give you badass, cool glasses. Whoa. To protect yourself. These glasses, you're supposed to wear them for 24 hours everywhere you go, inside the house, outside the house, everywhere, just so other people are reminded and you're reminded to not rub your eyes and to protect your eyes from dust or everything. They also give you some shields that go like that, and then you tape them over your eyes. With these, you can't really see very well, so you don't really want to wear them in the house, but you wear them during the time you're sleeping for several days, just so you don't rub your eyes accidentally while you're sleeping. I didn't find them too uncomfortable. Like, they're okay. You can, you feel them, but they're fine. Right after the surgery, you see kind of, not exactly blurry, you kind of see as if you're underwater, like as if there's like something in the air. But you see clear, like you do understand that you can actually see stuff without, and it's a good feeling, it's a reassuring feeling. For me, for the first 1 or 2 hours, I was very light sensitive and I had a burning feeling, but that went away. They advise you to go to sleep and take it easy. And that's what you should do. Sleep if you can, even. And then for the next like 48 hours or so, I still had a feeling that like there was an eyelash or something in my eye, and it came and went. Like, I would feel it and then I would not feel it. And it would shift like from left to right eye. It was basically just a feeling of discomfort. Again, not pain. After, like, when I woke up from the second night after 48 hours, ever since, I've been feeling great. Of course, the first 48 hours, you're just drowned in eye drops. Every hour, every waking hour, you have to get a whole set of eye drops. But that's good. It's like antibiotic, anti-inflammatory, artificial tears, and a number of stuff. And gradually, you go easier and easier. You reduce the frequency of the eye drops. Some people experience dryness or halos. I haven't experienced much of that. I've been feeling very comfortable after the first 48 hours. And I've been seeing great. You do have a follow-up appointment the next day because there are complications, so they want to check. There are possible complications, so they want to check that everything is fine. And then you have a follow-up appointment in a week, in a month, and I think in 6 months. You have to not rub your eyes, not use makeup, not use soap, be very careful when you have a shower, avoid like hot tubs, like, again, very reasonable stuff. You are allowed to just go back to using computers and regular activities after 24 hours from the surgery, which is great. You're not allowed to it's not recommended for you to go into dusty environments or do sports for a while after the surgery. And that's why when we went to watch monster trucks 3 days later, I had to wear a ski mask. That was fun. But we did watch the monster trucks. But again, I think it's very tolerable stuff, given that after that you see great. The advice I would have to give you if you're thinking about LASIK is find a clinic that has very good reviews, that has good reputation, and that has 24/7 support available. So just to have your peace of mind, just like if at 2 at night your eyes started burning, so you can call someone, an on-call doctor, and talk with them and see if they need to see you or not. I think that's very important for me. Take it a bit easier, arrange your life so you can take it a bit easier than they suggest. Because, you can go to work after 24 hours, but it's fine. Take 2 days off. Take it easy. Stay at home. Don't spend too much time in front of the computer for a day or two. And third advice, please read. Be aware. Inform yourself on all the complications and everything, but do not watch YouTube videos of the procedure before you have the procedure. There's no reason for you to have that image in your eye of how exactly they're cutting and sculpting. Like, it's a surgery. Like, there is no blood, but it's stuff that you do not need to have in your mind. Okay, so read, don't watch stuff before the surgery. You can go and watch them after and be like, oh my God, I did that. I rock. I'm brave. All right. So yeah, overall, as I said, that has been my experience. I would recommend it, but again, this is not for everyone, or not everyone is indicated to have this procedure. There are other procedures that may be more suitable for you, so please trust a good, reputable doctor. I hope it just gave you a bit of courage to at least explore your options. So yeah, that's it. Thanks for watching, and I'll see you on the next YouTube video or on stream. Bye bye.